Hubert Niesters. I work at the University Medical Center in Groningen. I'm Director of Clinical Virology. With transplant patients, big emergency room, a children's hospital, we want to have the results as quickly as possible to have impact. Because the most important stakeholder is still the patient. And he has a very simple question: doctor, what do I have? And doctor, how can you cure me and help me? If you will be a patient and you would like to get the result back, you don't want to wait for days or weeks. So you want to have this really within an hour, 1.5 hours. And you still have to think about transportation of materials towards your laboratory if it comes from outside. And you want to know why I call it point of impact and not point of care. If you think about point of care in the ISO guidelines, 15189 or 22870, point of care really implies that you need to have a point of care committee which says this is the instrument we should have. You need to do something about the training. You need to do something about traceability. And then if you have a number of these points arranged within your group or in your hospital, then it's really point of care. If you don't have that, you cannot just sell it as point of care. It's more point of impact, as I would like to mention it. It has impact on diagnostics, but you perform it yourself. And you also have to realize that a number of what they call point of care or what I call point of impact instruments are still in development. So in the future, it might be point of care. But at this moment, I call it point of impact. We use this kind of multiplex platforms mostly for the emergency room or from some departments. And it comes by tubing system. So despite we have a long hospital, the tubing system takes you less than 5 minutes to get into the lab. I think the most important thing is keep the patient as the most important stakeholder. For instance, physicians in a number of cases only want to have information on influenza. But the patient who is at the emergency room doesn't have the question, oh doctor, do I have influenza? The patient has the question, doctor, I have a problem, can you assist me? And I think syndromic testing is a way to move forward, definitely if you talk about respiratory infections. So the patient should be put in all instances as the most important stakeholder. That is what we are doing this, why we are doing this for, why the physician is doing it for, the lab is doing it for, the companies are doing it for.
QIAGEN.
Sample to insight.